Mastering bladder control, effective toilet training tips. Starting toilet training during summer can be a breeze, thanks to lighter clothing that's easy to remove and wash. Planning at least 3 consecutive days, devoted solely to bladder training, can kickstart the process effectively. The key: providing your undivided attention when your child needs to go. Empower your child by encouraging them to communicate their needs. Establish a routine: morning, after naps, meals, dry for 2 hours, and before bedtime. Regularly spending time together in the bathroom during these periods helps instill comfort. Keep your child engaged during their bathroom visits. Books about potties can be a helpful distraction. Encourage progress, whether it's sitting for longer periods or using running water to inspire bladder release. Just remember, moderation is key. Running water should encourage, not become a prolonged gain. Hydration plays a vital role. Offering fluids during active training encourages frequent bathroom breaks, aiding in response to body signals. Use timers as reminders for potty time, instilling the routine of anticipating the next step. Consistency is crucial. Maintain the same routine for several weeks to reinforce learning. Be patient. Occasional accidents, even after mastering the basics, are normal for some time. If you've tried all reasonable methods without success, taking a break and trying again later could be beneficial. Mastering bowel control in toilet training. Bowel control often precedes bladder control in children. Identifying signs of an imminent bowel movement can guide parents to encourage their child to relieve themselves on the potty. Remember, toilet training is individual. Some may achieve bladder control first. Discovering what suits your child best is key. Eventually, bowel movements become a daytime activity. Establishing a routine aids in bowel control training. Recognizing signs like play cessation or a change in behavior can indicate an impending bowel movement. Addressing constipation, if present, is vital but not a cause for worry. Foster understanding by explaining the transition to using the toilet or potty chair in positive terms. Guide your child gently, using pleasant tones and clear instructions. Timing bathroom visits after meals or during the usual bowel movement time enhances success. Encourage your child, offering praise for every attempt or success. Although using disposable nappies during this phase may require assistance, it's advisable to avoid mixed messages. Understand that boys may achieve bladder control before bowel control. For children struggling with bowel control, patience and gradual steps are key. Slowly transition from wearing a nappy to using the potty, offering encouragement at each step. Constipation may hinder progress. Identifying signs, such as dry, hard stools, is crucial. Address constipation sensitively. Seek medical advice if constipation persists, as there might be an underlying medical reason. Encopresis, lack of bowel control over age 4, affects a small percentage of children and often stems from chronic constipation or other factors. Treating encopresis requires a multifaceted approach, involving dietary changes, supplements, and behavioral modifications. Remember, it's a gradual process, not an overnight fix. Consult healthcare professionals trained in treating this condition for comprehensive support. Revamping diets for improved bowel control. In some cases, your child's challenge with bowel control may stem from their diet. Modifying their diet could significantly aid their ability to use the potty effectively. Here's a breakdown of dietary changes that might help. 1. Reduce milk products. Decreasing milk-based foods and opting for calcium supplements if recommended by a doctor can be beneficial. 2. Cut binders. Limit apples, bananas, rice, and gelatine, and consider including peaches instead. 3. Watch for chocolate. Large quantities of chocolate and certain medications might cause constipation. 4. Embrace fiber. Increase whole grain foods, bran, and roughage like lettuce and carbs. Diluting milk with water or offering graham crackers over soda crackers can help. 5. Monitor fluid intake. While decreasing fluids may increase appetite, ensure your child remains hydrated, especially when dealing with constipation. Encourage water consumption. 6. Include prunes and dried fruits. These help, as does consuming fruits and veggies with skins, seeds, and berries for fiber. Fruit nectars are also beneficial. 7. Allow adjustment time, it might take around 2 weeks for noticeable changes. Hold off on resuming training until you see these changes. 8. Consult a doctor. Loose stools could indicate underlying issues requiring medical attention, such as infections or allergies. A diet shift should always accompany medical advice. For starters, consider eliminating sweet juices like apple juice to test its effect. For some children, discomfort in releasing their feces may affect their toilet training. Listening to their cues and establishing a routine can be immensely helpful in such cases. Mastering daytime dryness. Your priority in potty training is helping your child remain dry through the day. Nighttime control comes later, since your little one won't manage functions while asleep. Establishing a routine aids confidence. Even before training, having your child on a schedule can smoothen the transition. By age 1, a predictable routine for eating, sleeping, play, and nappy changes primes your toddler for a potty routine later on. It needn't be rigid, but this consistency helps. Frequent bathroom trips are key. Encourage your child to sit on the potty briefly every hour, especially after meals or naps. While you can't control when they go, this practice builds a healthy habit. Knowing when to pause matters. Don't expect immediate results. If after a few minutes, nothing happens, or your child resists, it might not be the right moment for training. Observation can be educational. Children are curious about family bathroom habits. Letting them watch, and encouraging active participation in dressing and undressing can help. Consider door safety. Preventing doors from locking ensures your child's safety without disruptions. Boys and girls may have different approaches. Starting with sitting down can minimize mess for boys. Respect privacy and feelings. Potty training is personal. Some kids need privacy, while others might play around, saying no when they mean yes. Learn to interpret their cues. Initiate without asking. Taking your child to the bathroom without constant questioning helps them get accustomed to the routine. Patience is key. Potty training isn't instant. Be patient and adaptable if progress seems slow. Experts often recommend a reward system to encourage and motivate during this significant milestone. Unlocking the power of rewards. While opinions differ on rewarding children, using a reward system has proven effective in reinforcing desired behavior. It doesn't have to be extravagant. Remember, you're dealing with easily impressed little minds. Successful parents tailor rewards to their child's personality and preferences. A potty chart with stickers for each successful visit to the bathroom can work wonders. Upon reaching specific milestones, a small prize or a special outing can be a fantastic incentive. Ask your child for input on what rewards they'd appreciate most. Their enthusiasm for the reward will drive their efforts. Gradually phase out rewards as using the bathroom becomes routine. Over-reliance on rewards can lead to excessive visits to the bathroom. Remember, what works for one child may not work for another. Every child is unique, so find what resonates best with yours. While rewards are fantastic, your approval remains the ultimate prize for your toddler's accomplishments. Empowering your toddler with praise. Praise holds immense power for your toddler. It fuels their self-esteem, builds confidence, and serves as a great motivator. In the world of potty training, positive reinforcement through words matters. Here's how to make those words count. Frequent praise works wonders. Don't hold back. Shower your child with words of encouragement, especially during potty training. Celebrate their victories with enthusiastic phrases like "good for you" or "you did it." Combine words with physical reinforcement, like hugs or playful gestures. Create a fun, supportive atmosphere by adding a touch of silliness. Kids love it, and so do many adults. Remember, it's not just about celebrating success on the potty. Commend your child for staying dry too. Acknowledge their efforts even if they just sit on the potty without going. When accidents happen, keep calm. Don't let it overshadow the positive progress. Encourage them gently, and move on. "No big deal, you'll get it next time" is a reassuring phrase. Acknowledge every step. Even if they only sit on the potty without going, it's progress worth celebrating, especially in the early stages. Potty training isn't just about using the toilet, it's also about teaching good hygiene habits. Let's discuss this crucial point in Part 4.